Hello everyone, good afternoon. We are back on Dr. Gilead Show. I hope everybody's doing okay. Today is July 13th, 2017. We are on Dr. Gilead Show. I am your host, Dr. Theo Oswala. We are on Facebook Live, Dr. Theo Oswala MD. On Facebook, we are also on WBGR Radio. And if you're in the local area, you can call on 301-429-9247, 301-429-9247. That's on WBGR Radio. And you can also send us a tweet, also send us a message on our Facebook page, Dr. Theo Oswala MD. I am your host, Dr. Theo Oswala. Today we are continuing on our topic of dementias. So today I'm going to talk about a different type of dementia totally. This is the third most common dementias. If you remember, we've talked about Alzheimer's dementia with my very good friend, Professor Reginald. Last week we talked about another type of dementia, which is vascular dementia. And today we will talk about the particular type of dementia called the Lewy body dementia, or it's called, or it could also be called neurocognitive disorder with Lewy bodies. So please, I will advise that do not use what you hear on this platform to make a diagnosis of yourself or somebody else. It's always good to get appropriate diagnosis and the right treatment. Also, Dr. Gilead Show, the producers, and the host, our guests cannot be held responsible based on what anybody does on what they hear on this platform. So we're going to talk about dementia with Lewy bodies. Dementia, as I said last time, is simply a decline in our thinking skills and our ability to remember things. So this is a very severe, painful disease. You can imagine when you cannot remember what you ate this morning, or what who your wife or your husband or your spouse is. So in this situation, there is the ability of one to think, and in addition, there may be other symptoms. Now, Lewy body dementia is the third most common type of dementia. This is after Alzheimer's disease at number one, and number two, vascular dementia. It is estimated that about 10% to 25% of dementias in older people is caused by the Lewy body dementia. Many people with dementia of the Lewy body type, they experience movement symptoms such as the hunched posture. They also have muscle tightness, which we call muscle rigidity, and they also have the shuffling gait, difficulty lifting up their feet off the floor, and sometimes, and a lot of times, they have difficulty initiating movements. So you have somebody who is standing, and you say, come on, let's go. They try to take a step, it's hard to get their feet off the floor. And gradually, when they start moving, their gait is shuffling. They can't get their feet off the floor. And then on top of that, they have difficulty remembering things. This is classical of dementia with Lewy bodies. Now, what could be the cause of dementia with Lewy bodies? Now, this type of dementia was discovered by Dr. Lewy, who was working in Dr. Alzheimer's lab in 1913. And what he found was that there was a buildup of protein deposits. And he called these protein deposits Lewy bodies. These proteins will cause cell death or changes in the cells, in the neurons, in the nerve cells. Nerve cells are called neurons. Now, the Lewy bodies are present in the brains of people with this type of dementia, and they are also present in the brains of people with Parkinson's disease. So this is why, but also it could be found in the brain of people with Alzheimer's disease. So it cuts across some of these diseases, but it's known to cause more problem in people with dementia of Lewy body type. No one knows why they accumulate, but it happens. And we know that it causes these problems. Now, it is not clear what the genetic component or cause of this type of dementia is, but it seems that it has a higher risk in people of the same family, but it's very, very low. So really nobody knows why this happens in some people, and a lot of research is still going on about this type of dementia and dementias in general, because it is very common in older people and it's very frustrating. There are no clear treatments. So that is one of the reasons why I am talking about this series of dementia in this show during this time, so people can be aware of how it presents, so they can get help for their family and loved ones as early as possible. Now, what is the prevalence? How common is dementia of Lewy bodies? Now, like I said, Lewy body dementia is the third most common cause of dementia after vascular disease, the second, and Alzheimer's disease, number one. In the U.S., the dementia of Lewy body ranges from 0.1% to 5% of the general elderly population. So if you pick up 100 people, elderly above 65 years, you will have 0.1 to 5% of them having dementia of the Lewy body type. But also, among all dementia cases, about 1.7% to 30% of them will have dementia of the Lewy body type. So it's not uncommon. It is the third most common, and we have to really be aware of it. Healthcare providers, as well as individuals, family members, should know somewhat about this, so that you can help out and recognize it early. Even individuals. Yeah, I'm going to point out some of the symptoms and even early symptoms, so that if you're going through such symptoms, you can go get help early. It's also known to be more common in males, and the ratio between males and females is 1.5% in males and 1% in females. So it's commoner in males than females. So the question is, what are the symptoms of dementia with Lewy bodies, as to differentiate it from other types of dementia? Dementia with Lewy bodies, when it happens in people, the people will have what we call fluctuating levels of alertness to confusion. This could change from time to time, different times of the day, and even from day to day. So you have an elderly person who suddenly they are confused. It seems that they have a confusional state. They don't know what they're saying, they don't know what they're doing, and next time, or in the next 5 minutes to 1 hour, they are clear again. They can't remember what happened, so they have fluctuating levels of alertness and confusion, and this could alter from hour to hour or from day to day. So today you see them, they're doing good. Next time you see them, they're confused, cannot remember anything, and they can't remember what happened the previous day. This is a classical function. This is a classical presentation of dementia with Lewy bodies. Number two, very important, they have poor memory. Poor memory, they cannot recollect or remember things as fast as people who do not have dementia. But of noteworthy here is that the memory problem is not as bad as that in Alzheimer's disease. So it's not as common or it's not as bad as in those with Alzheimer's disease. So that is another pointer. They have memory problem. Also, number 3, these people with dementia of Lewy body type, they have poor concentration and attention. So you're talking to them or with them, they lose focus. Then you say, hey man, look. Oh, they come back to you. Oh, what were you talking about? They completely lose focus. Their attention span is very, very short. So if you talk for too long, they get distracted. They cannot follow what you're saying anymore. The other symptoms are when they are speaking, they have difficulty finding the right words. So you're talking and halfway they cannot find the word to complete their sentences. It's very frustrating and they struggle and struggle. Very, very frustrating situation. Sometimes they could present with visual hallucinations, and that is they see things that are not there. And some of the patients I see, the commonest thing they talk about is they see little animals running by, or they see little children, but actually there is nobody there and there is no animal there. They see a rodent or a rat, or they see a little girl run by, and you cannot convince them that there is no little child or no rodent there. So they feel like they are seeing these things, and you cannot convince them. They feel that that is there. So that is the part of the visual hallucinations or seeing things that are not there that is common with dementia of the lower body type. Now, they also have difficulty interpreting visual information. So you show them something and you say, hey, what is this? You can show them a picture, not a picture of somebody they know, but an artistic, an artwork. And any normal thinking person will recognize what it is and they can interpret it. But people with dementia of the Lewy body type will have a lot of difficulty interpreting visual information, pictures of drawn objects. That is another symptom. The other one is they have a lot of difficulty carrying out everyday tasks. So the regular day-to-day activities, like waking up, brushing your teeth, going to fix something to eat, they have a lot of difficulty doing that. So it is hard for them to do that, and they struggle a lot. So this is a very, very common and very frustrating symptom of dementia of Lewy bodies. They also have difficulty with what we call spatial awareness, so they lose a sense of place. So in spatial awareness, you know where you are, you know where your body is. I'm sitting on a chair in a studio talking, but sometimes people with such dementia, they can't figure out where they are. Their body is like, their body is somewhere else. And that causes a lot of problem for them. They also have difficulty walking and balancing. And this is made worse because they cannot lift their feet off the floor. When they are walking, their feet drops that way. And what happens is they trip on the carpet or on the floor. So they have very high chances of falling because their gait is shuffling. They can't lift their feet off the floor. That is a very major tasking problem for people with Lewy body dementia because they have Parkinsonian symptoms. They have symptoms that are similar to people that have Parkinson's disease. They also have a lot of disrupted sleep pattern, and they have nightmares. This is a very important symptom because in the very early stage of dementia with Lewy bodies, they have vivid dreams, they have nightmares, and they have what we call REM sleep disorders. REM sleep disorders are those dreams where people are dreaming, they have nightmares, and they're very violent. So they wake up, or they are still asleep, and they could punch the person on the bed with them. I have a patient I'm seeing now. The wife every night will run away from the bed and go sleep on the couch because he is sleeping and he is punching, and he's kicking. So a lot of the times he punches the wife, he kicks the wife, but he has no memory problem, and that's the main reason why they are seeing me. So we've been keeping an eye on his memory, his general cognitive function. So these people who have early dementia with Lewy bodies, they present with nightmares, acting out dreams that are violent, what we call REM sleep disorders, and so they have violent dreams and they act out on it, and they have no idea that that's what they did. So their bed partners, their wives or spouse, end up running away from the bed because they get punched every night. That's very tough on the family member. And ironically, they don't know what they're doing. Another pointer is they have slowness of movement, what we call dyskinesia. They have slow movement. They also have stiffness, muscle stiffness. They may have tremors, resting tremors, sometimes intention tremors, and also they have facial masking. They have this facial droop, and they have a hunched posture. They just drop like that, and their body is stiff, so they are walking like that without, they can't help themselves. And sometimes because they have a hunched posture, so their head is ahead of their body, so they're walking fast to catch up with the head. If they don't do that, they end up tripping and falling. And that's why falls are very common in this type of dementia, because their head is hanging forward, so they are running with short steps. They end up tripping because they can't lift their feet off the floor. So this is very common. They have short steps, shuffling gait, their head tipped forward, muscle stiffness, they end up tripping and falling. So this is very common, and they have the classical Parkinsonian look and movement. Other things that could happen because of muscle stiffness, they have difficulty swallowing. They have difficulty swallowing, and they end up may be choked. There was something yesterday in the news about elderly people in Japan choked by food. So the food they eat, they have to be pureed, they smash it and put it in a soft pureed form so they don't choke on it. So people with dementia of the lower bodies will have could have swallowing difficulties, and they could choke. The other symptoms are they may feel depressed, because this is a very depressing situation. People are sad. It could also be due to damage to certain parts of the brain because of the deposits of Lewy bodies in the brain. So they may feel depressed and other things. And it's very, very sad to notice that you cannot remember the face or the name of somebody you love so much. And you see them, you know them, you recognize them, you can't remember their names. Or you see them, you don't remember them, and you say, you can't remember me? I worked with you 5-10 years ago. Or you can't remember me? I used to be your pastor in church. Or you can't remember me? We used to hang out together, we played basketball together, or we did some fun things together. You can't remember, and the people feel very sad. The other symptom is they have fainting, they could have fainting attacks. So people faint and they pass out, they don't know why, and when they hit the floor, after some time they wake up. So that will affect other activities of their life, so they end up stop driving cars, and they can't take certain activities because they can pass out. For mental health care providers and general doctors and providers, these people, if they have hallucinations or difficulty focusing or some mental health activities, and you give antipsychotics, they have severe hypersensitivity reaction. So they are extra sensitive to antipsychotics, so you have to be very, very careful. They also have some of what we call autonomic symptoms, like they have increased heart rate, they have increased blood pressure, and they also sometimes have difficulty with controlling their bladder and bowels. So these are a barrage of symptoms that people with dementia of Lewy body type could present. Very difficult illness, very difficult to treat, but it happens in people, very common, the third after Alzheimer's and vascular dementia. I'd like to recognize Rick Perry. Thank you for tuning in. Bimbola and Dare and White, thank you for joining. Today we're talking about dementia of Lewy body type. Now, how do you make a diagnosis of this type of dementia? If you are well trained as a physician, of course not all physicians are trained with dementias, but especially neurologists and psychiatrists, especially geriatric psychiatrists like me, you are well versed and well trained in this aspect of mental health or medical problems. So how do you make a diagnosis? To make a diagnosis, you have to get a good history. You have to get a good history from the patient, also get collateral information from from family members, as well as other healthcare providers. You need to make out time, talk to their primary care physician, talk to family members, make sure that look at what they have observed in their family member, in their loved one over the past few years. It's important to get good history. They notice any changes that they've seen in the last few years or months, as the case may be. That will help you in making the diagnosis. So it's important that you find out what has happened, what are the things they noticed, and you will be able to help recognize the symptoms. So when you get a good history, you find out how long it's been going on, the changes over the years they've noticed, and based on the symptoms I talked about, you can ask about those symptoms, but also we have to make sure they do not have Alzheimer's disease and other types of dementias. And you will know this by looking at the other symptoms that they have that Alzheimer's dementia and vascular dementias do not have. Now, as a physician, what we do a thorough physical exam, and also do a neurological exam, have them walk and see if they have a shuffling gait. How do they walk? Do they walk stoop down? Do they walk with their inability to lift their feet off the floor? Do they have tremors? How is their face? Do they have their face all drooped out like that? So you have to look at all these symptoms, and that will help you make appropriate diagnosis. Other things you do, you check the vital signs. What is the blood pressure? And you can also call the primary care who's been seeing this patient for a long time and ask to see how the blood pressure has changed over time. Has the blood pressure been gradually going up? Or has the blood pressure been good? Or has the blood pressure just jumped from a normal level to a high level? What has the pulse been, the heart rate? What has the heart rate been like? From history, from examinations from other physicians who may have been seeing this patient, they may notice that the pulse has suddenly shot up. Once you do that, you get your collateral information from the primary care or whoever doctor that has been seeing them over a long period of time. Then you you need to also get complete blood work. You need to look at the complete blood count, and that will be the hemoglobin, the white blood cells, red blood cells. You can also get the platelets. You also need a comprehensive metabolic panel, and that will look at the blood sugar, look at the liver function test, the kidney function test, look at the electrolytes, look at all that, look at the cholesterol, and check out the thyroid and other blood work that need to be done. Once you look at those, you also need to get a look at the brain. You can send the patient for MRI, magnetic resonance imaging with contrast. That will help delineate the brain. So you will see, here you may see a reduction in the size of the brain compared to the skull. And you may have the ventricles. These are spaces in the brain where the cerebrospinal fluid is contained in the brain. So you may see widening of the ventricles, and also you may see the brain convolutions will be widened, and there's also less convolutions of the brain. So you will see wasting of the brain, reduction in the size of the brain. But if the person cannot get an MRI because probably they have a pacemaker or they have metal in their bodies, you can also get a simple CT scan with contrast. I sent a patient for CT scan because she has a pacemaker actually yesterday, and when she got there, we did not have her most recent renal function test, but because contrast, which is the dye that the radiologist injects into the patient, could cause some problem with the kidneys, we had to just do a CT scan without contrast. But it still gave us a good, clear picture of what we were looking for. This patient I sent yesterday has what we call atrophy, which is reduction in the size or wasting of the size of the brain, both the cortical, which is the surface of the brain, as well as the deeper tissues of the brain. She had classical atrophy of the brain, which is common in dementia. But what she had was more of the Alzheimer's type, because also genetically her mother died of Alzheimer's dementia. Other things you look at the, you can send the person for neuropsychological testing. This will help check out some of the behaviors, some of the difficulties in the concentration, as well as the other cognitive functions, memory, visual spatial, which is interpretation of the vision, as well as the space. How are they relating to their place in the space where the body occupies? So these are some of the difficulties that people have. But when you do neuropsychological testing, you'll find some of those. At this time, I remember we're talking about dementia with Lewy bodies, another type of dementia. And we're going to take a short break. Don't go away. Stay tuned on Dr. Gilead's show. And we are also on WBGR Radio. So you can call on 301-429-9247, 301-429-9247 if you have something to contribute or you have a question. We will be willing to answer your questions, and also we will accept your contributions. So stay tuned, don't go away. Rick, Dwight, Dari, and Bola, please stay tuned. Don't go away. We'll see you shortly. We'll take a break right now. Thank you. right, hello everyone. Welcome back to Dr. Gilead Show. Today we are talking about another type of dementia, dementia of the Lewy body type. Today we are on Facebook Live, Dr. Theo Oswala, MD, and also we are, as usual, on WBGR Radio, so you can call on 301-429-9247, 301-429-9247. I'd like to thank one of our sponsors, Paddock Healthcare Pharmacy. Paddock Healthcare Pharmacy is located on 5403 Annapolis Road, Bladensburg, Maryland, 20710, and their phone number is 301-277-7107. Paddock Healthcare Pharmacy is a family-owned pharmacy. Thank you, Paddock guys. Thank you for sponsoring our show. Thank you. So welcome back, everybody. We are on Dr. Gilead Show talking about dementia, Lewy body type. We talked about the symptoms, about the presentation, and right now let's look at how dementia of the Lewy body type differs from Alzheimer's dementia, which is the big one. So let's look at how is this different from dementia, Lewy body dementia, how does it differ from Alzheimer's dementia? Now, memory loss tends to be a more prominent symptom in early Alzheimer's disease than in early dementia of the Lewy body type. So dementia of the Lewy body type has less memory symptoms early compared to Alzheimer's dementia. Now, also, in Lewy body dementia, they have more movement symptoms. So, movement symptoms, difficulty with movement, are likely to cause more disability than in Alzheimer's dementia. For people to have difficulty with movement, it occurs much later in Alzheimer's dementia, but very, very early in a dementia from Lewy body type. Now, people with Alzheimer's problems, people with dementia of Lewy body type have difficulty with walking, balancing, and getting around, which is very common early, but this occurs much, much later in early and severe stages of Alzheimer's dementia. Also, it's good to know that hallucinations, that means hearing or seeing things that are not there, and also delusions, thinking and believing things that are not consistent with the person's culture, and also misidentification of familiar people are significantly more frequent in early stage of dementia of the Lewy body type than in Alzheimer's dementia. Also, in dementia of Lewy body type, the REM sleep disorders and REM sleep disorders is more common because these in Lewy body dementia, these people have difficulty with nightmares, acting out in their sleep, as I said, and chances of punching their spouse in bed early in the disease, even before the memory problem starts. And this is not common in Alzheimer's dementia. Now, also in dementia of the Lewy body type, they have a lot of disruption of the autonomic nervous system, which will cause increase in blood pressure, increase in pulse, and also dizziness and falls, and they may have urinary incontinence, which is not very common in Alzheimer's dementia. So these are the major differences between Alzheimer's disease and Lewy body dementia, but also both of them have memory problem. It's just that the memory problem is not very major in early stage of the dementia of the Lewy body types. Now the question is this: okay, we know all this information. how do you treat dementia of the Lewy body type? Very difficult. There are no known treatments for dementia of the Lewy body type. But like I said before, a lot of research is going on. And people are working day and night. A lot of work is going on, sponsored by different bodies to get solution to these problems. Because it is a major problem and it's becoming more common. So we hope that soon a cure, at least a way of managing the symptoms, can be found. Now, sometimes the medications we use for Alzheimer's dementia, what we call choline esterase inhibitors, things like Namenda or Memantine, or donepezil, which is Aricept, may be used, may be tried, but the question is, how much help does it give? Nobody really knows. But the main thing that we do as physicians is to treat the symptoms that follow when people have these type of diseases. So when people have dementia or Lewy body type and they have psychosis, we treat with antipsychotics. We treat with antipsychotics, treat the people symptomatically, and we treat them, and some people improve. They feel a little better, but it does not help their memory. Also, if they have depression, we treat the depression, and they do well as well. So we have people, once we manage the symptoms, people do well. Sometimes the REM sleep disorders are managed with medications like clonazepam and other benzodiazepines, and also mild, very mild sleep aids. One of the sleep medications that are used, some of the sleep medications that are used may cause falls, may cause disorientation. So we hardly want to use any of those. So but we try to see what we can do to give them good sleep so that they don't fall. So we may sometimes use very low dose of trazodone, and also sometimes very low dose of Vistaril. That may also help. But the regular sleep medications like Ambien or Lunesta, we don't want to use, because these are older people. They may fall and they may break their bones. So the question here is, who can help somebody that has dementia of Lewy body type? So we have trained physicians, different specialties, neurologists, and also geriatric psychiatrists like myself. We give good treatment to these people. So the question is, if you have dementia of the Lewy body type, the question that someone may ask, especially those in early stages, is, what can I do to help myself? So if someone has the symptoms I have described, they have muscle tightness, shuffling gait, REM sleep disorders, they're beginning to have some difficulty with memory, attention, and concentration. How can I help myself? So my advice to people who have these kind of symptoms is to adapt themselves to a daily routine. Do the same thing regularly, same time every day. So you adapt yourself to regular routines every day. Now, you may also make changes to your environment, and that is, you may remove clutters, things in your way. Make sure you do not have carpets that are folded. Make sure the room is flat so that you don't trip and fall. And rearrange your furniture to keep them in corners so that you reduce the chances of falling. Now, maintain good physical activity. Like swimming. Swimming is a very, very important. Swimming is very good physical activity, and yoga and Tai Chi also helps. So good yoga, good physical activity, also stay mentally active, that will really help. It's also good to follow up with your doctors as regularly as possible, so that they can check out your general medical condition, also check out your cognitive function, and also check out the non-cognitive functions. Sometimes frequent visits may be needed so that behavioral symptoms are treated. Patients who are on specific therapies can continue on that. These are all ways that you can help yourself, because the disease is a slowly, what I call slowly desiccating disease that hurts the individual. It's a gradual process. So before we look at the complications that people can have from dementia of the Lewy body type, there are a few people joining the show. I see Edwin, I think that's from Brazil. Thank you for joining. I see Attorney Ralph from Nigeria, also Dwight from Maryland, and also Jockey from Nigeria, and also Rick Perry from Maryland. There are a host of you. Thank you for joining. We are talking about dementia of Lewy body type here on Facebook Live, and also we are on WBGI Radio. You can call on 301-429-9247. What are the complications that can happen with dementia of the Lewy body type? So when people have dementia, a memory problem, what are the problems they could have? They get lost in the environment, so they have wandering. They wander around because they leave home, they cannot find their way back. So they get lost. They get lost for hours, sometimes for days, until the police or somebody finds them and bring them back home, or the police takes them to the hospital. The other symptoms they can have, complications, is they have delusions. They believe things that are not true. And that, what can that do? That will cause conflict with family members. They also have hallucinations, seeing things that are not there, or hearing things that are not really true. Also, they make poor judgments. They make poor judgments, and they get in trouble with the law. That is major. Sometimes they drive because they cannot comprehend where they're going. They get into accidents. They may be hurt or also hurt other people. The other complications are things like depression. They have a depressed mood, they isolate, they hide in their rooms because they know that they can get lost. They cannot carry out activities that they were used to doing. They cannot drive anymore, so they hide up in their apartments or in their rooms, close up the curtains in a dark place. That makes their depression worse. Also, they can fall, and they have gait abnormalities. They can trip and fall, break their bones, especially in females, because as the females grow older, their estrogen hormone is gone. What happens? Their bones thin out, and little falls, they will fracture their femur or other major bones. So falls, gait abnormalities, very common. And because they have muscle stiffness in the oropharyngeal area, that is the area that we use in swallowing, so they may have choking. Sometimes they have aspiration pneumonia. So these are problems. So what are the complications that can happen to caregivers? These are the people that look after them. So we have a caregiver burdens and stress. This I like to consider as a complication of the dementia, because people with this dementia or other types of dementia in general have to be looked after by other people. So this would increase both psychiatric and morbidity in the caregivers. Caregiver burnout. The caregiver gets tired, the caregiver feels that tries to do all they can to help these people. So what do you do as a caregiver? Like I said last time, to help these loved family members, because you know they cannot remember a lot, what do? You use short sentences, and keep the sentences simple. Don't talk too much. When communicating with the patients, use very short sentences. Go to the room. Go eat. Food on the table. So, because when you say, go to the dining table, your food is on the table, pick up the cutlery, that is long. All they may remember is go to the room. They may not remember the other subsequent sentences. So they end up going to the room, they get there, they cannot remember the other things. So you cannot say things like three-stage command. No. They get the first sentence, the subsequent ones they cannot remember. So it is very frustrating for you, the caregiver. Is also, remember, frustrating for the individual, because they really want to do these things that you ask them to do, because it's to their benefit. But when you say too many things at the same time, they're lost. They cannot do it. So you talk to them in very short sentences, and they will be able to comprehend and carry out those. Number 2, now simplify and create a routine for all self-care tasks. So make it very simple and make it a routine. So they know when I wake up in the morning, the first thing to do is go to the bathroom, brush my teeth. The next thing is go to the dining table and sit and wait for food to be served. And you have to, as a care provider, do that in that same sequence every morning. Once you break that sequence, it is hard for them to get back on it. So you must establish daily routines for them, for activities such as meals, medication administration, recreation and relaxation, and sleep. So they know that wake up in the morning, brush my teeth, sit at the dining table, eat my food, go play bingo or go watch TV, and if possible, take a walk inside the apartment or walk with somebody. And once they know this routine, they will follow it. And sometimes it's good to write those things down and make it bold where they can see it. This will help in reorienting the patient. So you use signs and pictures. So you may have a pictorial representation of what they're supposed to be doing at a particular time. So you may draw a clock and put 12 midday exercise, and it's pictorial. So they take a look at it. Even though people with dementia of Lewy body type, it is difficult to interpret pictures and drawings. But once they see it and they see it continuously, it will help them to remember, to recollect what they are supposed to do at that specific time. So you put signs and pictures and clocks and calendars. Also, because they are having memory problems, you will have to put family pictures. What does that do for them? If you put family pictures and they look at it every single day, the chances of them forgetting family members is lower, because they see the pictures every day. Especially the patient has to be also in that picture, so he will always remember himself, and sitting probably next to him is his spouse, and of course if they have children, also surrounding them are the children. What does that do? That keeps a clear memory of these family members. They don't forget. So when they come to visit, if they are in a facility where they are being helped by trained personnel, they don't forget their family members. And also, you can put a list of their daily activities. This is very, very important. Now, also for the care providers, please do not use confrontation. For example, you say, they come back to you and they say, I need to eat breakfast. They just had breakfast an hour ago. You cannot go fighting them that they had breakfast already. So what you're going to do is, all right, you want to eat? All right, come over here, let's take a walk. Let's go look at this. By the time you take them to play bingo, they just forgot that they asked to eat, to take breakfast. So distractions and distractors are very, very important. Do not use confrontation against them. Also, you need to control irritability. So when they are irritable, they are upset, find ways to distract them, to get them to do something else. Because they are going to get irritable because they can't remember a thing. They will feel irritable because they thought they had taken their medications. I have a patient who, she takes her medications, and the daughter comes to ask, did you take your medicine? She says no. But in the pill box for that day, for that time, say for morning time, it's already gone. And she says, I have not taken the medicine. And the daughter says, but look at the pill box. This morning, this Thursday morning, your pills are not there anymore. Oh, well, I did not take them. I'm sure somebody stole the medicine. Or if they live with another family member, they say, oh, yeah, James stole the medicine. He's been stealing my medicine all the time. But James had been to work. James had gone to work. James is not home. All you need to do is say, okay, you say you haven't taken your medicine. All right, I'll get you your medicine. And say, but anyway, come on, let's go to the kitchen, or let's go to the rec room, the recreational room. Let's go do something. As you take them, by the time they get there, they have forgotten about the medicine. But if you stay there, try to convince them or confront them to say you've taken the medicine, all you're going to do is but have arguments and get in trouble or fighting mood with them. So I have a patient, every time she tells the daughter, I don't want you to help me anymore because you are too controlling. And at a point in time, the daughter wanted to get guardianship. She refused. She said, no, I can take care of myself. But she cannot cook. She can't do anything. She can't feed herself. Actually, she can feed herself, but she cannot prepare her meals. So the daughter tried to get guardianship so she can make the right decisions for her. But she insisted. But of course, I knew how bad her illness is. I signed off on the guardianship papers, and the daughter is working on that now. So, as a care provider, at a point you may need to get guardianship to help your loved one so that you can make the right decisions for them. Even though they may not like it, but you will need to do it. And at a certain point in time, do not feel bashy, do not feel bad about it. You may need to put them in a facility where people are trained to take care of people with such a disease. And there's nothing wrong with it. It does not mean you do not love them. We know you love them, you care about them, but the best thing is to move them where somebody can appropriately care for them. Now, there are helplines out there. We have the Lewy Body Dementia Association, the LBDA, Lewy Body Dementia Association. So, and if you think that some of the symptoms I have talked about, are you seeing them in a loved one, you can call my office and schedule a time. I'm on 301-577-9111, 301-577-9111. Or you can also call the Lewy Body Dementia Association. Their phone number is 1-800-539-9767, and I repeat, 1-800-539-9767. This is the Lewy Body Dementia Association. You can call them. Also, you have the Alzheimer's Association helpline, and this is a 24/7 helpline you can call to get help for your family one. And that number is 1-800-272-3900. 1-800-272-3900. Also, in my research, I found out that even Social Security Administration has what is called compassionate allowance program, in which people diagnosed with dementia with Lewy bodies can qualify for Social Security disability benefits. And I know this also will be helpful to anyone that has any type of dementia across the board. So that number is 1-800-772-1213, and this is the Social Security Administration Compassionate Allowance Program. Compassionate Allowance Program, so SSA, Social Security Administration Compassionate Allowance Program for patients or workers who are diagnosed with dementia of Lewy body type. You can call 1-800-772-1213. So you can call the Lewy Body Dementia Association on 1-800-539-9767, or Alzheimer's Dementia helpline 1-800-272-3900. If you also need financial help, you can call the Social Security Administration for Compassionate Allowance program, 1-800-772-1213. Today we've talked about another type of dementia, the neurocognitive disorder with Lewy bodies, or Lewy body dementia, and we've talked about the symptoms, the presentation, the management. So please feel free to call for help from my office, 301-577-9111, and you can schedule an appointment to come see me. I also want to thank our sponsor, Paddock Healthcare Pharmacy on Annapolis Road in Bladensburg. Their phone number is 301-277-7107. Thank you everybody for tuning in today on Dr. Gilead Show. I am your host, Theo Oswala. I'm a psychiatrist, I'm a physician, a board-certified psychiatrist, certified by American Board of Psychiatry and Neurology. So please stay tuned. Next week, Thursday at 1 p.m., same time, same place, we'll be talking about another topic, probably another type of dementia, so that we can appropriately handle this disease process and manage it appropriately. Thank you very much for tuning in. See you again next week.